So we spent a couple of sessions just sort of talking about insulin and oral medications and diet and exercise. I really wanted to spend just one session talking about some of the injectable medications that are not insulin. Used to, every time we moved from an oral to an injectable, it was getting on the insulin train. And now, these days in diabetes, that's no longer the case. In fact, a lot of these medicines have become super popular. You see some of these medicines in Hollywood and some of the other places that have just made a big splash because not only are they treating diabetes, but they're treating weight loss. How often do you think you have somebody come in asking about some of the GLP-1 medications?
Probably almost every day.
Every day?
Yep.
Yeah, I mean, I would say that they've become very popular in the last, really 3 to 4 years. They've just really exploded. In fact, it's been kind of hard to get some of the medications.
Yeah, some of the pharmacies have definitely had a hard time keeping them in stock because they have become so popular. Not necessarily for the diabetes part, but for the weight loss aspect of it. Although they have helped tremendously with diabetes, but people are definitely wanting them more for the obesity side of things.
Yeah, that's really, I think, driven a lot of the shortage of it. In fact, even with some of the shortages, what we've seen is they've moved out of the traditional pharmacy world into some of the compounding pharmacies, and I see a lot of people who have been getting these medications through compounding pharmacies. Compounding pharmacy is basically a pharmacy who will take the medication and put it into a slightly different preparation. So it may not have the same name, brand on it, but it'll come in a vial, and then people are taking some of these injections, or even going to some med spas and getting injections while they're at the med spa for weight loss. But the FDA has come out and had some changes on that recently, haven't they?
They have. They want them to modify the compound a little bit, like add B12 or just so it's not strictly semaglutide or tirzepatide. And that's been popular also because it's a lot cheaper than
the cash price.
The cash price, yeah. The cash is a lot cheaper and affordable for people. So they're like definitely clinging to that a little bit more than.
But the insurance has been a little bit of the issue. So it's really for the people who are paying cash
right.
that are able to go and get that.
Right, because it still has been issues getting those approved with insurance. Or if it does get approved, it's still $500 a month, and some people just can't, afford that. So they go to the compounded.
And a lot of those, that people are having trouble with are almost exclusively when they're using it for weight loss versus when they're using it for diabetes.
Right.
Fortunately for diabetes, these are still very well at controlling blood sugar, and therefore insurance companies are very likely to pay for them from a diabetic standpoint.
Right.
In fact, I think I've even had some patients ask me if I would diagnose them with diabetes so that they could get on the medication.
Yes.
Which is highly unethical.
It is.
In order to do. And I always remind them that it's a good thing not to have diabetes as opposed to say that you do.
Yes.
Just to get a medication. What are some of the side effects that you've seen or some of the bad outcomes that you've seen with these types of medications?
Usually I'll see a little bit of nausea 1 or 2 days after taking it, maybe a little diarrhea or constipation. Usually it's whatever they're prone to. I have found that that's usually what they end up having. And then as they increase the dosage, there may be some stronger side effects. I mean, I've seen vomiting a few times, but mostly just a little nausea.
My mom actually had some of that when she was on some of these medicines, and about 2 days after she would take it, she would have some of those side effects, but she was having such a hard time controlling her sugars that the medicine worked really well for her sugar, but eventually she had to stop the medication because of the side effects.
Right. Yeah, there's some people who just have really had a hard time tolerating it, so they just give it up, but I've encouraged, if they can just kind of push through those first 2 weeks, it most of the time will improve.
Yeah, because it's not just hitting, that's one of the great things for treating diabetes with this is even though I think sometimes it gets a bad rap in the media for what people are doing and taking the medicine just for weight loss, for diabetes, it really is a great medication,
Right.
for treating just sort of multiple points of diabetes. And even, again, some of the, we're seeing that from an inflammatory standpoint, as well as there was even a recent study that suggested that it may have some protective benefits of the brain for people with Parkinson's disease. And again, these are all things that are out there that they need to be further studied in order to determine. But there's some promising things just with this medication that's out there. You know, and using it for weight loss. The other thing that I have seen is a lot of times when people solely use it for weight loss, a lot of times the weight comes back after they started. And a lot of times that's because when you're using this medicine, not only are you losing just adipose tissue or fat tissue, but you're also losing muscle mass. And as that happens, we all know that when we hit certain ages, our metabolism tends to slow down because of our lean body and fat ratios get to a certain point that muscle just uses more energy than fat does. I mean, that's what it's there for, is to store energy. And so once those ratios get offset a little bit, it's really hard to get your basal metabolism rate up, which means every day you need fewer calories and fewer calories. And so if people have just used it for weight loss without going through some of the proper diet and exercise to maintain that, then sometimes long-term it can actually be more harmful than it is good. And so while it's a fantastic medication on one hand, it really needs to be used in the right person.
Right, yeah, definitely initiating those lifestyle changes with that is key. Some people think it's just an easy out to lose a bunch of weight, but really they need to make those new habits, healthy habits to go along with it.
Yeah, I've had a couple people with pancreatitis, but those, even though that's on the big warning, and that's a very dangerous thing to have, those have actually been pretty rare in my experience. But I think, again, the key there is picking the right people to be on the medicine and not just making it a sort of a one-size-fits-all from that standpoint. What has been your experience in being able to get this approved for insurance and getting patients on this, just kind of over the course of the last several years?
So definitely need to have an A1C greater than 7. If they have any other comorbidities such as hyperlipidemia, hypertension, sleep apnea, that definitely helps as well. Chronic kidney disease has also been a new indication for that. They've seen a lot more cardiovascular benefits, so having those extra comorbidities actually can help it get approved a little bit better than just diabetes, but not in all cases. Sometimes it can just take that A1C of 7 and up greater.
And that really brings up another great point, because not only is it treating diabetes, but we're seeing that for people who have diabetes who are taking these medicines, they're actually having a reduction for certain ones in that class for heart attacks and for strokes. And there's other benefits outside of just controlling the blood sugar, controlling that A1C that people are having. And oddly enough, even though the weight loss may go away, people regain the weight, we are still seeing that 1 and 2 years out of people discontinuing the medication, that some of those health benefits are still persisting. And so that's an exciting area, just as we look over the next couple of years, that I think more study needs to be done and more things need to occur for us to better understand why that is. Because personally, I've got my opinions, but I guess we'll wait and see what the scientific community has to say about that. So it's a really exciting time. I feel like I'm saying that a lot to be treating diabetes, especially with these medications that have come out. Just so many more tools to have than we did just 10 years ago. The medications are far less likely to cause low blood sugar, and what's really amazing for me is, I'm old enough to remember some of the medicines that came off the market because they were causing things like congestive heart failure, and they were causing people to die sooner. And so those medicines got taken off, and we have now this new class of medicines that may actually not only just treat the sugar, but also treat all the other things that diabetes does outside of just people having high blood sugars, all the small vessel disease that we see in the heart and in the brain, in the eyes and the kidneys, and in the fingers and the toes. I really think this is going to be long term just a game changer for how we treat diabetes. Well, we do have a lot of fun here at Atlas.
We do.
Thanks for coming up and talking with me about this. Always good for me to be able to just get and shop a little bit. I'll let you get back down and see patients. We'll be doing a lot of these in the next few weeks, and we certainly invite y'all to come back and sort of join us as we move through different topics that are near and dear to our heart as well as our patients.